Who here has ever heard of deep vein thrombosis, or even better, who here has deep vein thrombosis? I have deep vein thrombosis, also known as DVT. It is a dangerous health problem and can be a very painful situation. Around 600 million people in the US are hospitalized each year for this cause. Whether people believe it's fatal or not, deep vein thrombosis has changed health history in the way of what it is, the dangers of it, and ways you can treat it. To know the dangers of DVT, you must know what it is. It all begins with one blood clot, and that forms in a vein deep down in the body. If you look around in your calf area, you might see dark spots that won't go away. And those are simple glimpses of a blood clot already formed in your body, as you can see right here. These brown spots are blood clots that have already formed in your body deep down. It's quite rare to see any blood clots form or cases of DVT up in your upper body. And right here, it's usually in the calf area and the thigh area. Okay? A blood clot is a dangerous factor that begins the deep vein thrombosis process. Blood clots occur when blood thickens and clamp together. A blood clot has the capacity to break off your vein and clog up some other vein, and that can stop the blood flow in your body. A known factor to cause a blood clot in a deep vein thrombosis situation is our injuries. When impacted, your body forms blood clots to stop the bleeding, and people suffer a lot, and the blood clots rise up abnormally, and that's quite dangerous. If you break a bone, you're in high risks of danger of having a deep vein thrombosis because the inner lining of a nearby vein could have been damaged and the number of blood clots would rise up. According to the Journal of Bone and Joint Surgery, when you are in surgery and the surgeons sew you up, you have the chances of that you're still bleeding, so blood clots will form abnormally to stop the bleeding. Right here. Blood right here is flowing up normally, and if you're a DVT person, your blood would go up normally, but blood clots are formed right here, and here's the detached blood clot that has the capability to stop your blood flow. It's very dangerous. According to the Mayo Clinic, when asked to identify DVT risk factors, 8% identify surgery as one of the factors to cause DVT, and 4% go to other health problems, which could be cancer, radiation, chemo. Knowing what DVT is, we must know the dangers behind it. One of the most dangerous situations of having a DVT is a pulmonary embolism. To understand, we should know the basic terminology. Pulmonary belongs to our respiratory system that includes our hearts and our lungs. And according to the MD Webster's Dictionary, an embolus is a loose clot, an abnormal particle circulating in the blood, and it can travel to the artery and lungs and block the flow, and that causes a pulmonary embolism. Pulmonary embolism, also known as PE, is a serious condition which is a cause of death for many people that had DVT. It damages our lungs and our organs, and the blood clot, loose enough, can go up through our system and stop the flow in our lungs and our circulatory system, causing the blood to stop, and that's no circulation in our body. PE restricts the blood flow according to the Vascular Foundation, causing our oxygen levels to decrease. About 300 million people each year that have DVT has gone up to a pulmonary embolism. And the blockage of our blood is quite dangerous. It's life-threatening. According to the American College of Cardiology, 30% of people with DVT have passed away, and 25% of those people that have passed away were of sudden death due to a pulmonary embolism. And 33% of the survivors will have a recurrence within the 10 years of a DVT. Thrombolysis kills around 100,000 people annually, and that's the combination of a DVT and a pulmonary embolism. Okay? Knowing the dangers behind it, we must know the symptoms and the treatment we must get. Our medic, it's quite hard to know when you're getting an embolism. So we rely on the symptoms that we would get, and that would be swelling in one or two legs. Skin is warm. We have discolored skin. Our veins are seen clearly, and we're constantly tired. We can't stand standing. And if you do get these symptoms, don't hesitate in calling 911. We must get a doctor right away. In most cases, if you don't see DVT coming, you most likely won't see a pulmonary embolism. And I want to ask something. Do you ever realize how many commercials are present about various health problems and none include a DVT? Many people aren't aware of the situation, and even hospitals don't include ads. And just exactly like a DVT, PE symptoms will be non-reliable. But if you do get one of these, which would be a sudden cough that causes you to cough up blood, if you have chest pain, a rapid breathing with a shortness of breath, or lightheadedness, you're most likely getting a pulmonary embolism and you should call the doctor right away. For treating DVT, our medication, um, the only chance is medication, and that would be blood thinners. And it keeps the clot from growing or breaking away. Blood thinners cannot thin your blood or dissolve the clots, unfortunately. And early studies show that life quality after a DVT is affected, mostly highly traumatic. I've been traumatized. My aunt passed away around a year ago, and she didn't get a chance to say I love you or bye to any of her family members, and that really affected the family. Um, it's important to get treated and know what's going on. Of all the in the past century, there are many health situations that have gone and come and gone, and deep vein thrombosis has made its way to our health history in the form of what it is, the way, the dangers behind it, the way you can treat it, and know what it is. DVT is a very serious health issue, and it's important for the audience to know that it's a situation that happens daily. There's people suffering daily from a DVT, and it's important to know the symptoms and know how to help a person or yourself if you ever come into these cases. So don't let DVT stop you from living your life. Allow yourself to live longer because you will enjoy